at St. John's with Christy, one of our lead therapists who teaches our preoperative joint replacement class, and she's going to go over one of the most critical aspects, which is walking. So getting out of bed and walking, and even if it seems overwhelming, it's something that every patient does. So Christy, can you just go over some of the mechanics of how people do that and how patients can practice even before they get into surgery?
All right, so what we use here is a standard 2-wheeled walker, has 2 wheels in the front and one on the back. So we will adjust it to fit you, and you'll have a walker to use while you're here. If you need one for home, then we'll arrange that. But for now, making sure you are well positioned in your walker, the first thing you want to note is, unless there was some type of a rare complication during surgery, you are going to be what we call weight bearing as tolerated on your operated side. That literally means you can put as much weight as you can tolerate on your operated side. So you want to try to use it when you're walking. However, if you can't, that's when we give you something like a walker to help you so that you can walk well, okay? So when you go to stand up, make sure you have your hands on the surface that you're sitting on and pushing with your legs to stand up nice and straight. Then you place your hands on the walker. If my left side is my operated side, when I go to step, I'm going to lead with my operated side, and I'll show you how, okay? So you're gonna put the walker forward first, make sure you give yourself some space to walk. You're gonna bring your operated foot first, and then your good foot. Walker, operated foot, and then good foot, okay? Once you get the hang of that, your therapist is gonna encourage you and coach you to be able to walk one foot in front of the other, okay? Now, if you're having difficulty doing that because it's too painful or it's causing you to limp, the walker is there for you to put some pressure on your hands, your upper body, and have to use some of that strength to take some of the weight off of your side, of your operated side, so that you can walk more normally without pain or without limping, okay? So walker forward first, your operated side, as you're weight shifting, if that's really hurting you, put some weight through your hands so you can bring your other foot forward and then relax. Walker, operated side, little weight through your hands, and then good side. As you get stronger, you'll be able to put more and more weight on your operated side, and you'll find you'll just be able to walk without using the walker.
Okay.
Okay?
A couple of things. How much weight do you need to put on your arms as you go through this? It seems like sometimes you're just touching the walker, sometimes you're really leaning on it.
Right.
What's the right amount of weight?
There's no right or wrong answer to that. In the beginning, for some people, it's like maybe 50%, okay? And it's only for a brief second though. So as you're weight shifting onto your operated side for that one little second, all of your weight's gonna be on your painful side. So that's when people tend to limp. So we encourage our patients to kind of use your arms for that split second so that it's not hurting as much. And then you should be able to take it off after that. So if you're starting at 50% of your weight on your arms, hopefully each time you're walking or standing or doing anything like that, you can put more and more weight on your leg and less on your upper body.
And I just wanted to go over 2 details. One is, I noticed that you lead with the operative leg.
Right.
Some might think that's counterintuitive. Why do we lead with the operative leg?
It is very counterintuitive. So the reason why we lead with the operative leg, walker forward first, and then my operated side, because here, all my weight's already on my good side. So I can actually advance my other leg forward. If I start that way, I have nowhere to weight shift my arms. I have to be here, and that doesn't work. So if I'm here, I can bring my operated foot, and then as I gently weight shift onto it, then I can use my arms. Otherwise, you're already starting at a disadvantage.
So we start with the operative leg because the other leg and the arms will protect the operative leg.
Right. It gives you a chance to take some of that weight off so you're not limping or you're not.
That makes a lot of sense. The other thing I wanted to ask you about is, I noticed you took a half step and you only brought the other leg up to the position of your operative leg. Why is that?
Well, because in the beginning, as you're trying to step, in order for you to bring your other foot forward, the time spent on your weighted leg is going to be longer if you're taking a longer stride. So we're trying to kind of eliminate any type of a limp or amount of time that you're in pain, giving your body a chance to catch up with you. So if you take smaller steps, it's easier for you to correct that. Okay.
So a short step is just mechanically more effective in the beginning.
Correct, yeah. But
Okay.
quickly, we try to advance you guys as quickly as we can so that you're walking as normally as possible.
Yeah. Again, using a walker, most people haven't done it,
Right.
and it's counterintuitive. And I think that's one of the main benefits of coming to your class is that they actually get to use the walker,
Mhm.
and you get to coach them on it and go through these mechanics even before.
Mm-hmm. It's like a mini therapy session.
Yeah.
My coach in here for that class the exact same way as it would coach you right after surgery, which
Oh.
is nice.
That's terrific. Thank you, Christy.